Right, let's just dive straight into this explainer and uncover the absolute bedrock of modern Western medicine. You know that moment you step into a clinic, put on that wildly uncomfortable paper gown, and wait for your doctor? Well, they're actually viewing your body through a highly specific, very defined lens that dictates exactly how they diagnose and treat you. It's called the biomedical model. So today we're going to unpack how this model actually works, where it came from, why it's been so incredibly successful at literally saving lives, and crucially, where its massive structural blind spots lie.
To really wrap our heads around this framework, we have to start with a seemingly simple question. Is health just the absence of disease? Now, for the biomedical model, that's a resounding yes. This is the core premise. It defines health strictly, and I mean strictly, as the absence of pathology, disease, or physical defect. In this view, health isn't some broad spectrum of wellness or a state of thriving. Nope, it's completely binary. You're either diseased because of an internal physical malfunction, or you're healthy because, well, no malfunction is currently present.
Part 1. The blueprint. Let's explore the theoretical pillars that built this entire model.
So, the foundational metaphor we're dealing with here is mechanism. Think about how you treat your car, right? When the engine starts sputtering or making that weird clanking noise, you definitely don't send the car to a therapist to, talk about its feelings. You take it to a mechanic. Their singular job is to pop the hood, locate the faulty spark plug, swap it out, and restore normal mechanical function. Well, the biomedical model sees you in much the same way, as a highly complex biological engine. It basically operates on the assumption that you occasionally suffer a physical, chemical, or microbial system failure, and that simply requires a mechanical repair.
And that brings us to the second pillar, which is reductionism. This is the guiding principle that massive, highly complex illnesses can be fully understood by just reducing them down to their absolute most basic biological parts. Rather than looking at the whole person, reductionism breaks systemic diseases into tiny cellular malfunctions, genetic mutations, or biochemical imbalances. Think of it this way. If you have a raging fever, reductionism doesn't zoom out to look at your stress levels or your living environment. It zooms in, closer and closer on your blood, until it isolates the exact microscopic bacteria causing the heat. It's literally a philosophy of isolating the micro-level physical error.
Then we have our third pillar, Cartesian mind-body dualism. We inherited this from the 17th century philosopher René Descartes. And fun fact, he literally believed the human soul hovered in the brain's pineal gland, completely separated from the body's physical gears. Historically, this model totally separates the mind from the physical body. In practice, that means physiological disease is investigated and treated completely independently of your emotional state. Because if the body is just a machine, your stress, your grief, or your happiness, they're seen as entirely separate from the gears and sprockets. To the strict biomedical model, a broken bone is just a broken bone, whether you're blissfully happy or profoundly depressed.
Part 2. The master mechanics.
Now, when we started treating the body as an objective biological machine subject to scientific laws, the results were, honestly, absolutely staggering. If we trace the historical victories of this mechanical approach, we see massive, game-changing leaps forward. Back in the 19th century, scientists like Louis Pasteur and Robert Koch essentially blew the doors off public health by proving germ theory, finally identifying specific invisible microbial agents that were causing widespread disease. And that breakthrough, it led directly to the 20th century, an era totally dominated by mass vaccination programs and antibiotics that wiped out infections that used to be an automatic death sentence. Fast forward to today, the 21st century, and this exact same reductionist science is driving precision technology. We're talking genetic sequencing, advanced imaging like MRIs and CT scans, which allow doctors to spot pathology at the cellular level long before a systemic failure ever actually happens. Because of this reductionist science, global life expectancy absolutely skyrocketed. I mean, we completely eradicated historical scourges like smallpox, a disease that had plagued humanity for centuries. We brought polio to its knees. If you've ever had a life-saving surgery after a bad car accident or taken a highly targeted antibiotic that cleared up a severe infection in a matter of days, you have the biomedical model's targeted, mechanistic approach to thank. By isolating variables and going aggressively after specific pathogens and localized malignancies, modern medicine has achieved survival rates that would have looked like pure magic just a few generations ago.
Furthermore, this model provided the entire theoretical grounding for evidence-based medicine, most notably the randomized controlled trial, or RCT. By isolating variables, testing a targeted intervention on a treatment group, and then comparing it against a control group, medical science set the absolute gold standard for testing drug efficacy. This incredibly precise, systematic approach acts as the ultimate quality control for the human machine.
Actually, it's exactly why you can pick up a prescription from the pharmacy and trust that it's been rigorously tested for clinical predictability and, most importantly, patient safety.
Part 3. The Ghost in the Machine.
But despite these monumental successes, we have to ask, what happens when the machine metaphor fails? Well, the limitations become glaringly obvious when we look at chronic illness. Look, the model excels at fixing acute physical trauma. If you have a fractured bone or a severe bacterial infection, finding the broken part and fixing it works perfectly. But it frequently falters with complex, multi-causal chronic illnesses, things like fibromyalgia, chronic fatigue syndrome, or long-term mental health conditions. Patients with these illnesses often experience debilitating, totally life-altering symptoms that simply lack clear-cut biochemical markers. And when the mechanic can't find a broken gear, it leads to severe diagnostic frustration, leaving very real human suffering largely unaddressed within a purely mechanical framework.
Additionally, by focusing almost exclusively on internal biology, the model leaves a massive blind spot regarding the outside world. Consider the social determinants of health: poverty, housing, employment, chronic stress, emotional well-being. Epidemiological data consistently demonstrate that these external social and environmental factors profoundly shape what disease incidence and recovery. In fact, your zip code is often a better predictor of your health than your genetic code. Yet, because a purely biomedical approach isolates the physical body from its environment, it really struggles to capture or effectively treat these massive external influences.
Critics also point to a phenomenon called medicalization. This is essentially redefining normal human experiences, natural variations, and standard aging processes as medical pathologies that suddenly require pharmaceutical or surgical intervention. Because the biomedical model is built specifically to find and fix defects, and over-reliance on this perspective can lead to what's known as the iatrogenic effect. In simple terms, that means the medical intervention itself actually becomes the cause of harm. Imagine aggressively treating a natural, mild aging process with heavy pharmaceuticals that just end up creating 5 new, severe side effects. It leads to overdiagnosis and unnecessary treatments that drive up healthcare costs without actually improving the patient's quality of life.
Part 4. Moving beyond the machine. Recognizing these theoretical and structural weaknesses has really driven the modern medical community to look for ways to evolve beyond a strictly mechanical view of health. Now, while biomedicine remains an indispensable pillar, especially for acute care and infectious diseases, of course, broader frameworks are desperately necessary to address the true multifaceted nature of contemporary health. Enter the biopsychosocial model. This comprehensive framework seeks to complement those vital biological insights with psychological and social perspectives. It basically aims to put the mind and the environment back into the equation, acknowledging that treating the machine is really only one small part of actually treating the patient. And you know, this push for evolution isn't some new fad. Way back in 1977, physician George Engel laid down a massive challenge to the medical establishment in the journal Science. He realized that treating the body in total isolation was deeply flawed, explicitly outlining the need for a system that treats the entire human context rather than just hunting for faulty mechanical parts. He recognized early on that while reductionism is incredibly powerful in a controlled laboratory, it is fundamentally incomplete in the messy reality of an actual human life.
So I'm going to leave you with this final provocative thought to consider the next time you visit a doctor. If we are more than just biology, shouldn't our medicine be too? How do we build a future of healthcare that retains the incredible, life-saving precision of the biomedical model, while also evolving to truly treat the whole person in their entire social and psychological context? Thank you so much for exploring the foundation of modern medicine with me today in this explainer. Keep asking those big questions, and I'll catch you in the next one.